Hi, Joe Scott, President and CEO of Jersey City Medical Center. Welcome to the Medical Center Show. Today we have a great guest. We're going to talk about hematology oncology with Dr. Amit Patel, the director of the Hudson Hematology Oncology. We'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back. Today we're going to talk about hematology oncology. We have a great physician with us, a member of the medical staff at Jersey City Medical Center, Dr. Amit Patel. He runs Hudson Hematology Oncology. He's the director of Hudson Hematology Oncology. He's located in our medical office building. Dr. Patel, welcome.
Thank you. Thank you. I'm glad to be here.
So tell us a little bit about your training background. You live in Jersey City, so you're a Jersey City guy, right?
I do.
Like me.
I have lived here for about 7 years.
Oh, great.
I did my medical school at St. George's University.
Okay.
And did my residency at UMD&J, New Jersey Medical School in Newark. I did a chief resident year there, and then I did my fellowship training at St. Luke's Roosevelt in the city.
In New York?
In New York.
Good,
so
good.
I actually moved to Jersey City and commuted back and forth to the city because I love it so much.
Jersey City fan for quite some time.
Absolutely.
So tell us, after, so medical school, then you did your residency, and then what, 3 years?
3 years to specialize in both medical hematology and medical oncology.
Okay, so tell our audience a little bit of, everybody talks about some of the work that you do, and they always think about you just around cancer, but you also deal with other diseases of the blood, right?
Absolutely. We deal with all benign diseases of the blood, anemias, different types of sickle cell,
so that's the hematology part of what you do, right?
That's the hematology part.
Okay.
And we also deal with other types of issues with blood in terms of clotting disorders, people who develop blood clots, any issues with malignant hematology, meaning lymphomas or leukemias, besides just solid tumors.
Right. So some doctors are just oncologists and some are hematologists and oncologists?
Absolutely.
So
some training programs just require medical oncology, which is 2 years. And the other training programs, you can combine both hematology and medical oncology. Some physicians choose to just specialize and treat only oncology or cancer patients, and even in that they go into a subspecialty of a certain type of tumor that they treat.
I see. So you really do any disease of the blood, including oncology. So,
Absolutely.
and you're located right in our medical office building, right on the campus of the medical center.
Right.
So what are some of the most common types of hematology problems that patients might present with?
We see a lot of patients with anemias.
Oh, you do?
They come in, it might be a young female who has anemia, a young male. to anyone that develops a blood clot. It's a very common illness that we see in patients both in and outside of the hospital.
Wow.
And other types of clotting disorders, basically. And a lot of them we do uncover some sort of family or genetic component to them.
Right. Oh, how do you like that? And how would somebody know that they've got that kind of disorder? I mean,
Sure.
you know, what's the common symptom that you generally see?
Sure. For anemias, it can range from anything to just some mild fatigue, an extra hour of sleep that you're requiring,
Wow.
to anything as subtle as a change or loss of appetite.
Wow.
A lot of patients with certain types of anemia, like iron deficiency anemia, they develop weird cravings for food.
Really?
So I have patients that eat ice nonstop.
Really?
If you see yourself developing a certain craving for food,
If you're chopping on ice all day long, then
Absolutely.
maybe that's something that...
I've had patients walk into the office with cups of ice.
Really?
And they have to wake up in the
How
middle
about
of the night.
spinach?
I wish that would solve the anemia.
That's exactly right. That would solve the problem. So do patients usually get referred from their internal medicine doctor to you when they
Yep.
suspect that there might be something wrong with their
Sometimes
blood?
it's just found on routine blood work when you go for your routine
Oh,
history
I
and
see.
physical,
Okay.
which should be done at least once a year.
Right.
That's when it can be uncovered.
When they do that blood work, when they take some blood from you, and they can
Absolutely.
usually see whether or not there's some type of anemia.
Sure, your blood count is looked at every time any type of blood work is done.
Right.
And it's mainly your hemoglobin that your provider or your physician focuses on. And a normal number is from anywhere about 12 to 16.
Okay.
When it's below that,
Then
you're considered anemic.
And there are different types of anemia, and what are the common treatments?
There's lots of different types of anemia.
Right.
And based on the type it is, it can be as easy as a pill that you take every day.
Okay.
Or
Like a vitamin to help?
It's an iron pill that you would
Okay.
take every day, to something that requires an infusion of iron
Oh, I see.
in our office,
Okay.
which would be just a short infusion. It's about 1 hour,
Right.
and it can be done once a week, and it's for a short time period.
Okay, so treatment seems to be
Very
pretty simple and easy.
Minimal side effects.
Now, you talked about doing these infusions in your office. So you
Yes.
have a big infusion center there?
We're actually on the first floor of the Christy Kerr Women's Center.
Right.
And we have an infusion center within our office.
Okay.
We have 2 certified nurses
Okay.
that do the infusions every day from 9 a.m. to 4 p.m.
Wow. And how many patients can you treat in this center?
Right now, we average about 30 to 40 patients a day, and that includes
okay.
patients that are getting both chemotherapy and other types of infusions.
Right. So if somebody's got this anemia and they need this iron infusion, simple, they can make an appointment with you, have the
Absolutely.
infusion done. They're usually in and out in an hour
Absolutely.
or so.
We have a lot of patients in Jersey City that work in the area, live in the area. They'll come before or after work or
Okay.
during their lunch hour, and
So it's very
we
convenient.
accommodate. It's
Yeah.
very convenient.
Yeah, we have great parking right there on campus.
Absolutely.
And you're on the first floor, so it makes it real easy for that to happen. The other thing that you do, obviously, is treat patients with cancer.
Yes.
And you are the medical side of cancer treatment.
Absolutely.
At the medical center, we've been doing some multidisciplinary tumor boards where we talk about patients with cancer. What role do you play in that, and how does that really work?
And, you know, I'm glad you brought that up. These tumor boards are fantastic because all of our cases, we try to discuss them, and we have all specialties present. Medical oncology, which is what I do,
Right.
mainly dealing with giving the actual drugs, the chemotherapy or immunotherapy. We have our surgicals specialties that are present, as well as our radiation doctors, our pathologists. So we really, I like to call it a meeting of the minds.
Right.
Each cancer patient is treated very differently. Someone with the same stage or same type of cancer may require a different treatment.
Wow.
And we like to discuss and dissect these cases
Right.
to make sure that we are giving each patient the appropriate treatment, which is both the standard of care and the best to have the best outcome.
So you get input from all these different specialties, the radiation oncologist, the surgical oncologist, the medical oncologist. I mean, it looks like
Absolutely.
you've got a whole bunch of experts in a room, and I hear that it's very well attended.
It's
And
very
there's
well attended.
Always seems to be 30 or 40 doctors there giving their opinion about what the best treatment is.
Absolutely, and we do it at least once a week.
Oh, wow.
Yeah.
Oh, that's really great. So once kind of the tumor board meets and begins to discuss a particular case, then everybody gives input, and then you come up with a treatment plan based upon everybody's input into it?
Absolutely. And, I let my patients know ahead of time that, we are going to be discussing your case at this tumor board.
Right.
And I let them know that it's going to be about 30 or 40 physicians.
Right.
And
Obviously all confidentially.
all confidential.
Yeah. Right.
It's all just within the confines of that conference,
Okay.
and that we are going to basically come up with the best treatment plan that the patient can receive.
We'll be right back with Dr. Patel.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Dr. Amit Patel, the director of Hudson Hematology Oncology, located right in our medical office building in the Christie Kerr Center. Welcome back, Dr. Patel.
Thank you.
We were talking about this tumor board and how important it is for patients who have cancer to kind of get everybody's input. Because sometimes when patients have a cancer, maybe surgery is the right thing to do, or chemotherapy is the right thing to do, or radiation oncology. And each one of the doctors who kind of provides that kind of treatment might look at this in a different way. So this multidisciplinary tumor board allows you the opportunity to kind of take some of your cases and get input from other physicians.
Absolutely, and that's that's what we want to do.
Right.
Because we want to make sure that the patients here in Hudson County are receiving the best treatment.
Wow.
And that they always will continue to. So we actually emphasize that, and we want all of our physicians to present these cases, so we come up with a good plan for the patient.
Right. Wow, that's great. And of course, you tell the patient you're going to discuss it, but everything's confidential.
Absolutely.
And that way, you get input from all these different physicians. It's interesting because the more I hear about the tumor board, I hear from many, many different kinds of doctors who go to that meeting and say it's a great opportunity for us to really discuss cases in depth and get input from so many different people to make sure that we do the right treatment, which is really phenomenal.
That's fantastic.
And it's different than other hospitals that don't have that kind of
exactly.
board.
And what's unique is that we have a lot of physicians out in the community that come to present cases as well.
Wow.
Because they know that we will all be there, and they can come up with a good plan for their patients.
That's great. So let's talk about oncology for a minute.
Sure.
That's one of the other major area that you treat. In addition to blood disorders, you treat patients with cancer.
Right.
What's the most common cancer that you see in your practice now?
Well, that's what I love about Jersey City is that I see anything and everything.
Really?
So it's some of the most unique cases that I've seen since we opened our practice.
Wow.
We see a lot of what we call solid tumors, lung cancer, colon cancer, breast cancer is very common as well.
Okay.
But we see a lot of other types of cancers, skin cancer, melanoma, bone cancers. Absolutely.
So really every
Everything.
type of cancer. Now, the Christie Kerr Women's Center obviously is a screening center, and we try to encourage women to come get their mammographies. So you see a lot of referrals coming from the Christie Kerr Women's Center?
Absolutely, and we have highly specialized machines that do certain specialized biopsies for breast cancer.
Okay.
And so we see even more referrals because of that, because it's a very highly unique, specialized imaging center.
Wow. So talk a little bit about, let's just say the patient comes to the Christie Kerr Women's Center, God forbid they have cancer. They actually take a little piece of the cancer. You take it to the tumor board and you talk about what's the best treatment.
Right.
But then they come for medical oncology.
Sure.
Don't you test the tumors now? And aren't there a whole
Absolutely.
host of new kind of modalities that allow you the opportunity to kind of figure out the best and
Yeah.
tailor the treatment?
That's
So
what we
talk
do.
a little bit about that.
We actually test the actual genetics of
Wow.
each tumor specimen. Certain breast cancers feed off of the female hormone, so we test each breast cancer specimen for that.
Wow.
And recently we've discovered that certain breast cancers basically emit a certain type of protein that harvests other cancer cells.
Oh.
And we can test for that. We call that targeted therapy.
Mm-hmm.
So it's not a type of chemotherapy with the same side effects as chemotherapy. It's a targeted therapy.
Okay.
So it's still given as an infusion, but doesn't have the same side effects.
Okay, so it's not necessarily a chemical treatment? It's
It
some
is-
other type of...
It is a chemical treatment, but
Okay.
it only targets the cancer cells.
Wow.
It
So-
doesn't cause side effects to other cells in the body.
And how do they go about kind of determining that? There's a special lab that does
The
this?
pathologist is,
Mhm.
is our go-to person for this. And
Okay.
each breast cancer case goes through this testing regardless.
Wow.
So we have that information to discuss both with the patient and at our tumor board.
Oh. So, I think a lot of patients think about oncology and chemotherapy and kind of the side effects that are associated with this. Sounds like with this therapy, you kind of minimize that
Yeah.
altogether.
Absolutely, and it's tough because most patients and most people out there, when they think of chemotherapy,
Right.
the first thing you think of is a patient that has no hair,
Yes.
and
right.
that's basically vomiting every day
Right.
with their treatment.
Yeah.
But that was about 20 years ago.
Okay.
Now we have so many newer, stronger medications that we don't see nausea and vomiting, and actually because of that, our patients gain weight on chemotherapy,
Wow.
not lose weight, because they're not vomiting anymore.
Huh.
And with these targeted therapies, we don't attack other cells in the body, so we don't see side effects like hair loss or
Wow.
other problems with infections because your cells are lower in your body
Right.
after the treatment.
Right. Now, so with this targeted therapy, it's an infusion that you give?
It's an infusion. Some of them are actually now available in a pill form.
Oh, okay.
So
you
it's
don't
a
even-
pill that you take every day, and
Wow.
it's treating your cancer.
Huh, how do you like that?
Yeah.
Now, are there some other biological treatments for cancer also?
Absolutely.
I
We
hear
have,
a little bit about some-
Antibodies that we've discovered
Okay.
that attack these certain types of cancer cells. And we use these in all types of cancer, including colon, ovarian,
Okay.
and certain lymphomas. And it's what we call a monoclonal antibody. It's targeted, again, just at the cancer cell and not at other cells in your body.
So previously, when people would get chemotherapy and they would have, I would say, non-targeted therapies that would just try to kind of wipe out the tumors, what caused all those side effects were the fact that you couldn't target it just to the tumor.
Right, exactly.
Or to the cancer. So now you've got these really specific modalities that allow you to just target it right to the tumor, and
Absolutely.
people don't get those same side effects
Absolutely,
anymore.
and we have newer drugs in the pipeline basically that are targeting the genetic component of
Wow.
tumors. So we test a patient's tumor for all genetic components as well.
Okay. So you talked about some chemicals that target tumors, antibodies. Is that an injection also usually, or?
That's an infusion.
That's an
usually.
infusion.
And it can range from about an hour to 2 hours.
Okay.
And that's done in time intervals.
Right. And so you take the tumor, you test it for those antibodies, and then turn around and get a very specific antibody for that tumor.
Exactly.
Specifically for that patient and what they.
Specifically for that patient.
Wow, that's really it's kind of like, swallowing a pill and having it find the tumor and
Exactly.
wipe it out.
And that's what it does. That's
That's
exactly
pretty
what it
amazing.
does.
Wow, that's really, the technology has really come a long, long way.
Absolutely.
Right? Okay, we'll be right back with Dr. Patel, and we'll talk more about hematology oncology. Thanks.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back. We're here with Dr. Patel, the director of Hudson Hematology Oncology, located right in our medical office building at the Christie Care Center. Dr. Patel, we were talking about some new modalities and how those modalities really don't impact patients the way we always think about chemotherapy and the treatment of cancer. You know, people losing their hair,
Sure.
or people getting sick from the chemotherapy. Now, some patients still require that kind of treatment where they will lose their hair or they will get sick.
Yes.
And what do we do for those patients? Because you still have to do some chemical treatment,
Absolutely.
right? Yeah.
Unfortunately, with some of our treatments, we haven't reached that degree of specificity where we can't have these side effects. And you do see patients that do get hair loss. That's probably the most common thing we see right now with a lot of our treatments. The thing I tell my patients is it's temporary.
Right.
We're doing this to cure you and to control your disease. And if you've ever wanted to try a different hair color, this is the time to try
This is your chance.
it. Yeah, exactly.
That's good. That's putting a positive spin on it. Now, for those patients who still might get sick, in terms of vomiting or anything else, what do we do to prevent that? Because there's some new drugs out there that really work really well to prevent that,
Absolutely. A lot of the patients get IV medications along with their treatments that prevents any type of nausea and vomiting.
Oh, I see.
And then they're usually on a regimen of pills that they take after their treatment for a couple of days to control that as well. So we do have very good measures to control that compared to what we did about 20 years ago.
You know, it's interesting. So we try our best to really target the tumors. It looks like you can use a chemical target, or you can use those antibodies that you talked about. If that doesn't work, or you think that the best treatment is other types of treatment, you can pretty much mitigate any of the side effects. So, you know, hematology and oncology has come a long way in the last 20 years, it sounds like. It sounds like you guys are right there, state-of-the-art center. You've got all the treatment modalities at your
available in our
fingertips.
backyard.
That's right, in our backyard. That's great. All right, well, obviously we're all about maintaining people's health and trying to keep the community healthy. Talk a little bit about what some of the things that you see that are reasons why people get cancer.
Sure. Well, like we know for years, smoking is probably the #1 reason that most people develop some sort of cancer in their lifetime. Both for smoking and secondhand smoke. But you know, the main thing that we can do to prevent cancer is just lead a healthy lifestyle. Exercise every day, have a healthy diet. Make sure that you get good follow-up with your primary care physician. And that you're doing screening exams at the appropriate age when you should be doing them.
So talk a little bit about that. There's very specific screening exams like mammography and colonoscopies, those kinds of things. So what's the recommendations for mammography now?
So mammography, women should start having their mammograms at age 40. Men should start getting screened for prostate cancer at age 50. Now, we've seen in years of studies and research that certain types of ethnic populations need to start their screening earlier. We recommend that African American males start prostate cancer screening at the age of 45. And everyone at the age of 50 should start getting a screening colonoscopy.
And how frequently do you need to do that? So for mammography, they need to do it every year? Or?
Mammography can be done every year to 2 years. A colonoscopy should be done every 10 years. Prostate cancer screening should be done every year. And pap smear should be done every year as well.
Now, it's important that you go to a state-of-the-art mammography center, for example, like what we have at the Christie Kerr Women's Center. Because I think one of the things they do, is compare previous films to find out what happens today.
And you always want to stay at an imaging center where you've had it done before, because that way the physicians can compare your previous tests and make sure if there's anything suspicious, we biopsy that. And actually at Christie Kerr, we have highly specialized ways to biopsy these what we call spots when we see them on mammography, and it can be done the same day.
Now, obviously, for anybody who's ever smoked, quitting smoking is a really, really hard thing to do.
Absolutely.
We've got a special stop smoking clinic at the medical center. Do you refer patients over there?
Actually, once I meet a patient and they have any type of smoking history, that's one of the first referrals they get.
You do, And any feedback from those patients?
Well, the patients really like the support groups. Because they kind of see that there's other people